We've invited Sue Abderholden from NAMI Minnesota to help us learn about resources that are available to hopefully prevent tragedies like this one. Sue, thank you for joining us today.
Absolutely.
We hear the term mental health crisis. I might have think someone just having a breakdown immediately, but that might not be the case. So what are the warning signs people should be looking for?
You want to look for changes. So changes in appetite, changes in sleep, even not being able to do kind of your daily living activities, not finding joy in the things that you used to find joy in, and then just frankly being incredibly sad.
And those can seem subtle almost, where they seem like just a little bit of a change in behavior, but we're learning there could be clearly something underneath there. What are some steps the other person can take, the friend, the family member, to step in carefully and just try to see how can I be of help?
So listening. It's a huge thing. Don't try to solve it. Don't try to fix it. Ask a lot of open-ended questions. Listening is really the power tool of providing hope to people who feel hopeless. And so you just really want to be there for them in a very compassionate and empathetic way.
So you've started to listen, but maybe you don't have the knowledge or the resources. How do you take that next step? How do you find them the help that can get them over the hump and maybe change what they're going through?
So there's a couple of things. You want to ask them if they're actually thinking of killing themselves. Doesn't plant the idea, and a lot of people answer truthfully. And if they do, and if they have a plan, you want to take immediate steps. So in Minnesota now, and of course across the country, we have 988, which people can call for a mental health crisis, not just for yourself, but for a friend or a family member or a loved one. And they can also provide advice. In Minnesota, we actually have mobile mental health crisis teams covering all 87 counties, and you can reach them through 988 or look at your county's website to find the direct number. That will help too. Sometimes if it's not that kind of immediate crisis, people are like, well, I can't find an opening anywhere. Mm-hmm. So what I would suggest is actually call the phone number on the back of your insurance card. Sometimes companies will prepay appointments to get someone in early, which can be very helpful. There's also a website called fasttrackermn.org where you can put in your zip code, your health insurance plan, and who has an immediate opening. That can get you in fast too. Lastly, a lot of our community mental health centers, or what we call our certified community behavioral health centers, actually you can get in within a day or two. And so those would be another place to go and reach out.
And we know time is of the essence. You said earlier, asking the person, have you thought about killing yourself? That feels like a very tough question just to let out of your mouth. Is there a right way to say it? Is there a right scenario or setting to be in to have that conversation?
If you're worried, ask. It really is that simple. And again, it does not plant the idea. And it gives people the opportunity to actually share if they are thinking about, taking their own life, if they are really that depressed and feeling that hopeless.
Yeah, if it really is that big of a deal, you're going to remove that concern and ask that question. Sue,
absolutely.
Thank you so much for coming on, Sue, and talking about this topic that we know can be difficult just between us, but for the people really going through this. If you or someone you know is in crisis and needs assistance, as she said, you can text the National Suicide Prevention Lifeline at 988 anytime, 7 days a week. We've also shared additional resources to NAMI and more on our website, WCCO.com.